Who's ever governed knows the single hardest thing about government is taking a good idea and turning it into reality, right? That's the tough thing about government. And so governments need help with fixing that basic capacity problem that they often have. One of the things we're looking at is how, for example, we can get a group of people together who are prepared to go and help governments plan out their energy needs for the next years and how they might attract sustainable finance, okay? Secondly, I think it's also each country needs a development plan, and it needs it based on the realities of how people are living. So, for example, one of the great problems in Africa is that people are, they don't have access to proper cooking materials, so they burn wood and charcoal. That has a bad effect on the environment, but also around about 1 million people die every year as a result of doing this. So this is a huge, obviously got a massive health impact. And if you look at some of the most troubled parts of the world today, where there's a climate crisis, it's often in the poorest areas. The result of that is you get terrible health problems, but also it starts to destabilize the governments because they're not providing for their people. So I think the second thing I'd say is you need that national plan. And again, you need that to be the product of a partnership with the outside world and the government themselves. And the third thing is just to pick up on what Dr. Merriam was saying about agriculture. Agriculture is also a source of emissions. How we do agriculture differently will be a really, really important part of how we tackle this problem. And remember, in many parts of the developing world, half the population or more are engaged in agriculture. So if these smallholder farmers aren't enabled to farm better, with higher yields, but from less use of fertilizer, the ability, for example, to know, this is where, for health reasons as well, the encouragement of the use of data is extremely important. You're able to predict weather, you're able to predict different conditions for people so that they know if they're a farmer how to farm more accurately and better. So all of these things just come together, in my view, in practical changes. And I think one of the things that needs to happen in the next year is we literally isolate each of these major problems, like the UAE initiative, for example, around mangroves, okay? You take each of these major areas and you work out a proper practical plan for implementation. And I think that is sometimes best done not in the heat of the rhetoric around climate change, but actually through the people who know what they're talking about, sitting down together and saying, okay, here's the practical problem we have to solve and here's how we solve it. And I think if we took that approach in the next year, we'd find that when we get to the next year's COP, it will be much clearer as to what it is people need to do in order to have any chance of meeting our climate ambitions.
Could I just add? Please. Could I just add something to what Sir Tony said? Just to give you, I like to be someone who inspires and brings hope into the room. If I look back 4 or 5 years in the UAE, the ag tech sector, so this is the sector, the agriculture technology sector, was very, very small. But when you look at innovation and technology and where we are today, some of the facilities, I mean, this is where we talk about vertical farms, but these can also be horizontal farms, diagonal farms, it doesn't matter. But all of them are closed system environments where water is recirculated. Now, when water is recirculated, that for us as a water scarce country is very important. If we can crack the idea of using this kind of innovation and being able to harness solar energy, for example, and have these decentralized farms where they're using technology and using solar power, for example, we could solve so many issues when it comes to food and health. Because the problem is now a lot of these vertical farms, they're very high in capex costs and they're also very energy intensive. So this is something that we have to crack now, but it's so interesting to see that a desert country like the UAE we're now able to grow berries, salmon, quinoa, in closed system farms. And this is it's a new way. And for us, a country that imports most of the food, the taste of the food is so different for us because we're actually getting this fresh from the farm. So innovation, technology, and we need your ideas as well. I see a lot of young people in the room as well. The research and development in this is so important because we need to take this to the next level to solve the global problems that we have.
Thank you. I think both of you have kindly demonstrated the importance of capacity building in combination with the use of technology, especially as young climate experts. We have such an innovative capacity and untapped potential when it comes to addressing technology and integrating it within climate solutions, whether it's climate adaptation, mitigation, and most importantly as well, loss and damage. So I'll come back to you again, Your Excellency, and you've mentioned the net zero carbon plan of UAE and such a very important transformation and transition to net zero carbon. So what are the learnings and how did were you able to make it happen?
First of all, I want everyone to understand that going on a pathway to net zero is a pathway of opportunities. People need to understand that this is not a pathway where you say, oh, there's more costs on us. When you look at the long term, actually, it's cheaper. It's better for humanity. It's better for the planet. And this is why the UAE is going down this pathway. We believe it's a pathway that will attract new industries, new technologies, new skills. It will attract also new people to come to the UAE because we're lucky we have the leadership, we have the ambition, and we like to see us as, again, hope, as a beacon of hope for many people. And so pursuing the net zero pathway is for us a natural step. Again, coming back to the trend setting, we were also the first in the region to announce a net zero strategic pathway. And for us, this is all about, we already for many years, we have the UAE Green Growth Strategy, the Green Agenda. We've already been going or thinking in this way. And very soon as well, in a few days, we'll be announcing the Green Toolkit for businesses on how they can basically green their operations as well to pursue the net zero. Just wanted to explain to you now, I was telling this to Sir Tony as well, something we did in the UAE was we held monthly meetings with hard to abate sectors. So we had a meeting with the cement companies, we had meetings with the waste sector, with the industry sector, with the transportation sector. And these were monthly meetings we had with the private sector to understand what are the bottlenecks that they're facing. How can we green their sector more? How can we put the ambition higher? So they told us maybe there were some policies that were outdated or there were certain things that was happening on the ground that we didn't realize. But having this very close, informal also conversations with the private sector really helped us take those inputs and be able to develop our pathway. And also in a few days' time, we'll be announcing here our detailed roadmap to net zero by 2050. So looking at all the sectors and how we're going to get there, because this came up at COP26, right? Okay, 2050 is so far away. What's going to happen in between? So we'll be looking into that, and I look forward to seeing many of the faces come back.
Yes, so I think this is the perfect end to our panel. A massive thank you and an invitation, because I will personally be there to see the roadmap and learn from that amazing transition. I'm also very proud to be here in Egypt and to have the opportunity to, as Your Excellency mentioned, pass the baton to UAE. And massive thank yous again for your time, for your valuable insights. And then if the audience, yes, would like to proceed with the next panel. Very much. Yeah. Thank you so much. Your Excellency, thank you.
microphone to Tala. We'll give her a microphone.
We were given microphones, so we have to zip 1, 2.
Here? Okay.
Thank you all for staying with us. We're going to start the second part of our session, and we're going to now translate the incredible examples of the leaders that were with us today into practical and pragmatic solutions for climate and health. So allow me first of all to introduce our inspiring speakers. First of all, we have Dr. Desta Lakou. She's the Global Director of the Partnerships and External Affairs for AMREF. And I'm very happy to have shared with her the stage just yesterday and looking forward to her insights. We also have with us Dr. Alison Fahey, who is the Executive Director of JPAL MENA for the American University in Cairo, which is so fundamental here in Egypt as being also living in Cairo. And we also have with us Dr. Tala Al-Ramahi. She's the director at the Office of Strategic Affairs for the Crown Prince Court of Abu Dhabi. And then finally, a dear friend and Professor Alan Danger. He's the director of Climate Change and Health at the Wellcome Trust. So thank you all for taking the time and being with us at this very important discussion. I'd like to direct my first question to Dr. Desta. So what can you tell us about the health effects of climate change that the communities in Africa see, and how is AMREF tackling that?
Thank you so much. I'm really glad to be here. I hope everyone can hear me. I think for us, as the previous panel spoke, the impact on Africa is significant. I think we have 3% carbon emission, but the impact on us is significant. AMREF is a health development organization, and we deal with communities where they live, whether they're pastoralists, but we are working in and within the community. So the impact of climate change, largely we are seeing, is around droughts and flooding. And what does that mean? That means that people, water infrastructure that we are installing with the people through our programming is being destroyed. We are seeing increase in hunger, in malnutrition. We are seeing increase in vector-borne diseases such as malaria. We are seeing a disruption of basic services such as immunizations, childhood immunizations, maternal care, etc. So the impact of climate change is being seen and felt very deeply in communities that are poor, that don't have access to health care as it stands, and really have nowhere to turn to because our health systems are so fragmented and so fragile. And we saw that during COVID, the impact. So we are operating in really extreme circumstances in many cases. And I think for our communities who are rural and typically hard to reach, there is no access, easy access. So we recognize, and then also most of them are pastoralists, they live out in the community. And so we have realized that we need to look at health delivery or health service delivery, not just as improvement of health infrastructure, but also understanding that people, animals, and environment are intrinsically linked. And so our approach to addressing the needs of communities also has to shift. And so we are now looking at, how do we gear our interventions so that we have a whole of society approach? And that is what we call One Health. Yeah, so we're really looking at that. And what does that mean? If I can just break it down very quickly for you. So what does that mean? That means we have, for example, One Health events. What is that? We actually bring in health professionals, we bring in the veterinarians so that people come out into the community to see us, and we provide animal care. At the same time, we're providing care for individuals as well, deworming, those kind of things. We look at, rangeland ecosystem management. Her Excellency mentioned earlier that we're looking at climate resistance facilities, wash facilities. We are looking at, treat and recycle. What do you do with water? With waste, you treat it and you recycle it as fertilizer. So really, we are shifting our approach to see if we can accommodate. But of course, we can't do it alone, and we need partners. We need investment in countries. We need governments within themselves, whether it's the ministries of health, the Ministry of Agriculture, education. We need intersectoral collaboration within country as well. Yeah.
Very powerful and very on point in terms of how we need all hands on deck and a multidisciplinary collaboration, especially when we are addressing the compound effects of climate change, not only on our health, but also on the social determinants of health and access to healthcare services, as well as the capacities and the resilience of our facilities in rise of the emerging crises that we're seeing, and climate change is one of the most important. So I'll turn back to Alison in terms of the evidence that you are seeing around climate change and health, and how can policy help us address the evidence more effectively?
Perfect. Thank you. Thanks very much to the UAE and to the organizers for welcoming me here. So I'll start with maybe the second piece of the question on the relationship between policy and evidence. First, from the J-PAL perspective, we feel that policy should be informed by rigorous evidence, but it does not always exist. And there's an imperative to act, and there are crises that are taking place now that require a response. In that case, our hope is that policymakers are using the best available information and trying to innovate, trying to come up with interesting new solutions like One Health, it sounds like. And then where we don't yet know about the impact of something, that's a tremendous opportunity to partner, and perhaps we should speak after, about opportunities to test and to learn from these new innovations as they are taking place. So first, just on that link, I want to underscore that. So where we don't know, we should act, but we should learn while we're acting. Huge opportunities there. Now, on the relationship between, or the impact of climate change on health, I'll share a few points. I think we all know that structural disparities mean that low-income populations are suffering the brunt of kind of disproportionate effects of climate change, from extreme weather events to loss of livelihoods to air and water pollution, kind of the list goes on. And as a community of practitioners and policymakers who are focused on climate change, focused on poverty reduction, we know that in both of these areas, unfortunately, there are no silver bullets, and there are not that many easy win-wins. Ultimately, the ways to address poverty reduction, the ways to address climate change are going to be an accumulation of a number of different approaches that are tackling different aspects of the challenge. So at J-PAL, what we do is we bring rigorous evidence into this discussion from randomized evaluations to try to understand what is effective and what is cost effective in improving outcomes, in improving climate mitigation, in improving adaptation. And insights from some of this research suggest that there are things that we can do today. So I'll take a few minutes to talk about a few of those. And at this COP, I think that's especially important, where the focus here is so much on kind of moving ahead towards implementation. And as we think about implementation, we want to think, what do we already know? What evidence can we draw from? And where are we announcing brand new innovations? And again, we should be prioritizing the opportunity to learn and to evaluate. So starting with the health links with mitigation and with pollution reduction. So first, pollution is a not hidden health cost that already is killing millions of people around the world, reducing average life expectancy by a couple of years. And the returns to effective regulation of pollution are very high. So this should be on our agenda together with other sort of more explicitly health-focused policies. Now, from an evaluation perspective, we've asked, what actually works to effectively reduce greenhouse gas emissions and to reduce the carbon co-pollutants that have really significant health costs. And we've done this work at the industry level and at the household level, since again, the solutions sort of need to come from multiple different levels. So at the industry level in India, we're currently working on evaluating emissions reduction strategies by helping to set up and to evaluate emissions trading schemes in Gujarat, ultimately looking at the effects on health, the effects on air pollution, and the effects on firm bottom lines, which are an important factor here. And an initial evaluation found a 24% reduction in emissions at no additional cost to firms. So on the basis of this research, the state government has decided to expand this trading scheme to more than 200 additional industries and has just announced launching a similar scheme for CO2. Now, shifting to something that Sir Tony mentioned toward the end, agriculture is a major component, of course, of emissions. And so here, another ongoing study in India looks at ways to try to curb the widespread practice of crop burning, which is a major source of air pollution. And in this case, the study is looking specifically at how payments to farmers to encourage them to adopt less than panelists were speaking about earlier. So there's evidence that flood-resistant crop varieties or rainwater harvesting techniques can increase food production, can increase farmers' revenues, even in the face of extreme weather. And again, because these are going to feed into nutrition, they're a component of how we should be thinking about health solutions. I'd love to talk further about expanding access to energy. I won't, and hope we'll have some time to come back to it. But I think the main thing that I want to end on is just that obviously the health consequences of climate change are serious. There's a lot that we don't yet know. We need to be doing new innovation, but there is a lot in terms of the existing evidence base that we can draw from as we're moving forward, as we're focusing on implementation. But as we do, program design and program delivery really matters. So we'd be very happy as JPAL to share the evidence that we do have to help you design your own programs going ahead, and we'd really love to explore opportunities to evaluate, to learn about the impacts of new kind of climate and health-related interventions that organizations are starting.
Yes, amazing. Thank you so much. I think it's very important. And one thing that you said, like calculating how many lives are lost because of, for example, air pollution and the use of fossil fuel, but we can also frame it in the way of how many lives can be saved and how can we utilize the health argument in terms of facilitating the necessary climate finance that is needed, which transitions perfectly to my next question to Tala. In terms of reaching the last mile, why is there a specific interest in climate change, especially in climate finance?
Thank you very much, Dr. Punia. Thank you everyone for being here with us today. For those who don't know, maybe I'll take a step back first to explain what Reaching the Last Mile is. Reaching the Last Mile is a portfolio of global health programs that are funded by His Highness Sheikh Mohammed bin Zayed, President of the UAE. This is philanthropic funding that is channeled towards disease elimination efforts, and more specifically, diseases that are within the last mile of elimination or eradication. His Highness continues to be one of the major donors on polio eradication, for example, but more pertinent to our own conversation today is the funding and work that's being done on both malaria and neglected tropical diseases. And of course, we can't talk about disease prevention without talking about climate change and how that impacts outcomes and global health outcomes when it comes to disease elimination efforts. Climate change continues to be a public health emergency, and we cannot continue to proceed with pre-existing strategies on disease elimination without integrating how climate change is affecting this work. And so that is why we have become much more proactive in integrating climate proofing when it comes to disease elimination. Because unfortunately, climate change currently is at the risk of kind of setting back decades of progress on disease elimination. And for us, we've started to proactively reach out to both donors, but also multi-stakeholder partners who are becoming much more interested in this kind of efforts. We've had many conversations with Wellcome on how the climate and health nexus is critical. But also, unfortunately, still there is a lot of data that we are missing to better understand how climate change is affecting infectious disease elimination, which has been a priority of His Highness Sheikh Mohammed bin Zayed. Unfortunately, a lot of the funding that's channeled towards understanding this has been focused on priorities related to the global north. And for us, and a lot of the work that we do through our portfolio has been focused on the global south. I'll mention one particular project that has been funded by His Highness, which brings in multi-stakeholder efforts, including integrating the private sector on addressing how we can climate-proof disease prevention programs. This program is called Forecasting Healthy Futures and is a partnership with Malaria No More, where we brought in both private sector partners as well as donors to leverage climate data as well as artificial intelligence to better predict when and where malaria outbreaks could happen. As Alison mentioned, due to climate change, the pattern of malaria outbreaks has changed, and to better understand how that changed, we need to use the data to create systems and early warning systems for countries to better prevent disease outbreaks. And so that has become one of the emerging priorities of His Highness's portfolio on disease elimination, and why a conversation on the climate health nexus is incredibly important for our portfolio, but also incredibly important for the work that we're all doing on this as well.
Thank you so much. And it's so important to address as well disease elimination and how now with the changing environment, it has been accelerated in many countries, especially in the most vulnerable and who lack the least capacities to understand the situation. I remember I once did last year an exercise with the World Health Organization. We looked at all the available literature on climate change and health in the past 10 years, from 2010 to 2020. What was interesting to discover that the region that had the least data around it was actually the MENA region, which brings the importance of having more research around the effects of climate change on the health, especially in the region. And this also brings into the question I have for Professor Alan, in terms of research around climate change and health. How important is it? We realize how Wellcome Trust has done such a fundamental role in addressing research around health, and how climate and health is important to bring that.
Thank you very much. I will answer the question, but I would like to start, if you'll permit me, by acknowledging Omnia, who has moderated an hour's worth of quite hard discussion, and she didn't introduce herself at the beginning. So Omnia is the COP27 Youth Envoy and is an amazing doctor who represents 1.5 million young doctors around the world, and it's fantastic what you do. So I just wanted to put that, let everyone... And now I'm going to answer your questions. It's about research. Why do we need research? What's it for? What are we trying to do? So Wellcome Trust is a global funder of research that seeks to tackle global health challenges. And there can be no bigger global health challenge than the challenge of climate change, which is going to fundamentally change everything we understand about public health. Every single last bit of what we understand about public health. And the need for us to act at scale and with urgency is now. There is an enormous need for us to start planning now, not only to respond to what is already happening in many countries across the world, but also to prepare health systems for the future so that countries can protect, as Tony Blair was saying, protect their populations. So how do we do that? Do we stick our finger in the air and say, well, there's going to be a bit more malaria over here and there's going to be a bit less food over there, or do we do the research? Obviously, we do the research, and we're here to transform the generation of the evidence which will enable policies to be made safely with evidence from the region. So we are determined, both through our efforts, so Wellcome has made a commitment to spend £16 billion over the next 10 years on discovery research and research on 3 challenge areas, which are climate change, infectious diseases, and mental health. And we will be using that enormous resource to really transform the generation of evidence on the links between climate change and health, the immediate and enormous benefits that accrue to health as a result of climate change mitigation, and understanding much more clearly many of the things that we've discussed from JPAL about when we adapt, what are the impacts on health? We don't know many of the impacts on health of adaptation actions that governments are already delivering. We must use those opportunities to evaluate and learn. So without that information, we're asking policymakers to make decisions like this. That is not safe. That is not sensible. So we must, number one, learn as we deliver policy, because we cannot wait. But number two, we must generate the evidence locally produced by local researchers to provide local evidence for local policymakers, so that there is confidence in that evidence. And the greater, so Talan mentioned, Omnia mentioned that there's almost no evidence for the MENA region on climate and health. We did a big systematic review last year using machine learning. It's a fantastic paper. You must read it. But it maps the evidence base around the world, and there's almost nothing for the MENA region, and there's very little for Africa as a whole. So most of the evidence currently is in Europe, North America, China, and a few other places. But there are huge parts of the world where there is no evidence. So we know what's going on. We know that climate is changing. We understand the pathways from climate change to health impact, and generating the research to enable safe and effective policy action is core to what we will do at Wellcome, and core to what needs to happen.
Thank you. And you've touched upon such important points around, first of all, mental health and climate change, which has such a gap, especially when understanding how does climate change affect mental health, how disproportionate it is according to age, gender, and so on. And at the same time, I think the four of you were able to show us the importance of having a powerful health argument for climate change, especially that we see now such a slow progress towards a crisis, and we need more urgency, we need more seriousness, and as Professor Allen said, we need a powerful evidence base to drive the policymakers towards the right, effective implementation policies to protect the health of the environment, which automatically our health depends on, as well as the health of the future generations. I know we are a bit short on time, and I would need to conclude the session, but it was so amazing to have the four of you here and to be facilitating this very important conversation about health and climate change. I hope you feel as inspired as I am, and our guests will be there as well for any questions by the audience later. But before I end, I would like to invite a very important speaker, who is Yusuf. Is he with us? Yes. So Yusuf, he is the youth delegate to Community Jameel, and we'd like to hear from you your thoughts around climate and health.
We need to do quite a bit of research and evidence generation for the conference.
Right, perfect. Hi, everyone. First of all, thank you so much for the UAE Pavilion for hosting us today, and thank you so much for the panelists for the very informative comments throughout the session. So my name is Yusuf Azem. I'm a 24-year-old Egyptian, and I'm the youth delegate for Community Jameel. And now I can safely say that throughout my life, I've been privileged enough to live in Cairo, where I had access to proper education, proper healthcare systems, and proper housing and infrastructure. Where on the other hand, a fellow Egyptian with my same genetic makeup, the same health profile, living in a rural community in a slum in Cairo, or in a tent in a village across the Nile somewhere in Egypt, might not enjoy the same quality of life I was privileged enough to have. And they'd probably be more prone to deteriorating health conditions, a higher risk of infections, and a lower capability of mitigating the negative health effects by climate change, which we've been discussing with the panelists. So, and I'd like to touch on, follow up on what Dr. Omnia said about the social determinants of health, because the social circumstances and the environment and the ecosystem surrounding an individual do have an important and direct impact on the quality of life and health outcomes of an individual. So my first question to the panel would be, how can we catalyze policy and institutional change to ensure health equity inclusion is implemented in national systems? Underserved communities globally and in the MENA region specifically are the ones taking the hit, especially those at a financial disadvantage. However, what we don't realize is the immense role these communities play, whether it's community cleaning water techniques, for example, using traditional methods, or pollution and waste management systems. We have so much to learn from them, and we need to include them in the conversations through the innovative solutions that they have to offer, informed by both traditional and indigenous wisdom, into the decision-making processes and policy design arenas. So I do think we indeed have a health crisis at hand. Nevertheless, the social and economic factors are compounding the multifaceted problem, and we need to tackle the question of health and climate change using a holistic approach. So I believe that the solution here isn't just ensuring enough doctors make it into med school, for example, but more rather than taking a closer look at the root causes at hand of the challenge to try and preemptively tackle the factors that make up the problem as a whole. So I'll leave you with my final question for the audience and the panelists. What efforts can we take to narrow the gap in health disparities, and how can inclusive institutional change of these communities fast-track the process? Thank you.
Is that an answer we're expected to question?
No, that's very difficult.
Is that a question we're expected to answer?
Take the question.
That's it.
If anyone wants to take the question,
Yeah, I do. I do.
please.
So, thank you so much for bringing it up. In my view, working with local communities in sub-Saharan Africa, largely, we're in 35 countries, what we really need to do to access the community, because we don't have data. We don't have informed data. So what we would do, and what I would suggest, is we pick ourselves up from the very comfortable seats that we are in, walk over to the community, wherever they are, and address their needs. I think that's what we don't do. The fact that health is just coming into to the climate change conversation is a shame. Really. The impact on human life is so significant. So why don't we leave our seats, go into the community, get data and evidence, get our politicians together, get Treasury to release funds, get our partners together to join us so that we can at least change the lives of the people that are suffering the most. So I would say my answer to you is, let's get out of these conference and convening facilities. Let's walk over, go down to some of the communities that we serve. Let's understand their impact, and let's recognize that we don't have research and evidence. Research and evidence in sub-Saharan Africa is lived experience. It is, when did the rain come last year? When did the rain come 5 years ago? When do we think the rain will come tomorrow? So understanding and speaking the language of the community is also very important. Yeah.
I think an amazing answer. Thank you so much. And yeah.
Excellent.
Thank you.